Jude basket. So these are my conflicts. I would just briefly say one slide about blood pressure lowering. Is this really a good endpoint? Is the sympathetic nervous system really in control? Do we have some evidence outside renal nerve ablation? And then what is the renal nerve ablation blood pressure lowering effect? Is the St. Jude comparison in comparison with the others? And we'll also quickly embark on the Simplicity 3. So when we look at clinical trials, you can see that the blood pressure reduction and the reduction down below and the reduction in events is pretty linear up to a reduction of blood pressure of about 15 to 20 millimeters of mercury. So this is a good surrogate endpoint, and we should really focus on this also in the future. Now the question, is the sympathetic nervous system really involved? And I think when you open any physiology book, you can see that actually the sympathetic nervous system controls everything. So it should work, but does it really work? And I think that the only proof that we have is from the surgeons, where they actually did a splenectomy, sympathetic splenectomy, and showed in these 4 groups of hypertensive patients that you see here, that in the most severe ones there's actually a reduction in mortality that's also notable by trend in the other less severe hypertensive groups. This was 1953, before we had any drugs. So the principle should work. So the question is, do the systems work that we have? And we have already heard a little bit about all those other systems, and of course the St. Jude one is the newer one. Now, does this really lower the blood pressure? We have a first registry that was smashing, that you remember, published in the Lancet by Murray Esler, who is the spirit of rector here of the field, with a reduction of about 30 over 17 millimeters of mercury. We actually confirmed this with a cohort where half of the patients got a St. Jude basket and half of them the Simplicity catheter, and we saw actually very similar reductions in office blood pressure, with no difference between the 2 devices. Now the Enlightenment trial used the basket we just heard about, and this basket has been tested in a trial that's published in the European Heart Journal, where they actually showed very similar reductions in this number of patients, around 50 patients, already at 3 months and already at 1 month, quite significant reduction. Maybe it's a bit quicker than what we saw, as you saw 2 slides ago, with the Simplicity device. Now the Vesic system that we will discuss in a minute also is very similar, and these systems that have 4 poles, they simultaneously ablating, where you can have 8 lesions in one vessel. It seems that they are both reducing blood pressure a bit quicker than with the Simplicity device. Of course, this was not a randomized trial. Then there was a lot of discussion whether ambulatory blood pressure is reduced, and Felix showed really that this is the case. If you really have high blood pressure, then also ambulatory blood pressure is reduced. We have used this also in our registry with the Simplicity and the St. Jude basket, and we saw also significant reductions with ambulatory blood pressure, although less pronounced than office blood pressure in both at 3 months and at 6 months, and at 12 months, of course, the numbers become a bit small. Now, the only randomized trial we have, and that's the only one that we have with the older systems, besides the new one that I will discuss quickly, is the Hypertension Simplicity 2 trial with lower numbers than Hypertension 3 trial, and that actually confirmed what we saw before. So we were very excited that we could actually get very similar reductions in blood pressure. But then came this paper that you all read, and here, of course, there are some differences. First of all, it's a bigger number, and we would certainly need that for St. Jude as well, and the other systems that we will hear in a minute. With this sort of number, otherwise we will not convince the community, and also we probably need to have a sham protocol. There is a major difference between this trial and the other trials, that a quarter of the patients were of Black origin, and they have, as you know, low renin hypertension and may differ in their mechanisms causing blood pressure. Here, of course, The reduction in blood pressure was substantial in both groups, but very disappointingly, no difference between the two. Now, we, Felix and myself, we published this online in the European Heart Journal, and I invite you to read it. So if we compare the three, there is a huge difference that is very difficult to understand between Simplicity 1, 2, and 3 in reduction of systolic and diastolic blood pressure. So the question is, what are the differences, what are the problems that we can learn for all the systems? Well, it may not work. I think the surgical data show that it might work. It may not be adequately performed. It may not be the right catheter, and they are now, as we heard, newer ones that may be more effective. The population may not have been selected well. There may be patients that are not responding. For instance, those with low renin hypertension, we have to figure that out. And patients that may not have been stabilized with drugs. You saw a marked reduction in those in the medical group. And then eventually the patients receive too many drugs possibly to show an effect of RNA. So if we do a randomized trial with the basket, which we plan to do, we certainly have to assure that the patients don't have 5.5 drugs, because then it's really difficult to show anything above what has already been shown. So interestingly, there are other effects that seem not to correlate with blood pressure necessarily, that the group from the Saarland has published, both on left ventricular hypertrophy reduction, and there is a new paper now in the European Heart Journal with MRI confirming this, and then of course in patients with metabolic syndrome, the effects on insulin resistance, glucose, and alike. So what can we conclude so far from what we have learned with the different systems? I think that renal afferent and efferent sympathetic nerves regulate blood pressure, and their activity is increased in hypertension, that we can sign off. There's a lot of science for that. The renal nerve ablation reduces sympathetic nerve activity and tissue norepinephrine levels with most systems that we heard, including the St. Jude system. So at this point, we can also sign off that. In the registries, the treatment-resistant hypertension patients lower blood pressure up to 3 years over around 30 over 10 millimeters of mercury, and this is also true for the St. Jude system. But of course here we may have regression to the mean. Everybody that's involved in hypertension trial knows that there is a lot of regression to the mean, and particularly if you start to change treatment before randomization, you may in addition have carryover effects that affect the results. In randomized trials, the evidence is really controversial, and I think that St. Jude should now really think about a trial similar to Simplicity HDN-3 to show that their system really works better than what we saw in this trial. In this trial, of course, what we can learn that there are several issues that make the interpretation difficult. We should have operators that have a huge experience with these systems before we can embark into a trial. And of course, we need more evidence with newer devices such as the St. Jude basket and clinically applicable tests to prove effective renal nerve ablation. We should know at the end of the procedure that we actually did what we claimed we did, and so we need functional tests to show that, and possibly imaging as well. And eventually then we can go to outcome trials. Thank you very much for your attention.